Hello, hello, hello. Welcome to another live from yours truly, Jennifer Yon with Jennifer Yon Agency. Today is Tuesday and it is Talk About It Tuesday. We have some great things to talk about. I have a doctor in the house, Doctor LeGrande. You may recognize Dr. LeGrande. She was one of the past covers of IBA Success Magazine, the Health and Wellness Edition. With so much going on right now, with COVID-19, I felt it so necessary to allow her to be the first Talk About It Tuesday series that has started due to the fact that we are home and we cannot get out like we need to do, but staying connected to the public, bringing awareness is still very so essential. So thank you so much, Dr. LeGrande, for coming on in on Talk About It Tuesday. How are you today?
Oh, I am wonderful. I'm working from home, girl. I'm loving it.
Yes, I know. I'm still kind of getting comfortable with working from home, because I'm always out networking. I think I'm having some real live people withdrawals right now.
I understand. I don't have that problem.
Maybe you can help me with that after we talk about what we got going on today.
Absolutely. Absolutely.
So, Dr. LeGrande, tell us a little bit about your background, what it is that you are doing right now.
Well, I'm a family practice physician. I love family practice because we get to take care of the whole person. We take care of the whole family. I like to say from the womb to the tomb. And we get an opportunity to get to know families. And so I've been doing family practice for probably as long as you've been alive. So 30 plus something years. So I would say that many of those who are watching right now probably were in diapers when I first got started. So I've enjoyed what I do, but I've done everything from inner city healthcare, rural healthcare, mobile medical care, pain management, primary care. But my whole focus has always been taking care of those who nobody else really wants to take care of. That's always been my focus. So that meant I took care of marginalized communities, poverty-stricken, inner city, places where people didn't ordinarily want to go. That's where I wanted to go. And that's pretty much been my career focus. Over the last few years, however, I've learned that telemedicine was going to be the way to go. 2 or 3 years ago, I knew that telemedicine, even though it's been in existence for a couple of decades, it was not mainstream. Some insurance companies offered it. I went into the tourist area saying, listen, let me be your doctor by telemedicine. Everybody was like looking at me like I had two heads. And so then coronavirus came and telemedicine is like on the forefront. And I'm like, okay, I got you now. We're ready to talk telemedicine and I'm ready.
Well, today at Talk About It Tuesday, we are talking telemedicine.
Yes.
COVID-19, everyone is stuck to be in the home, and there's a lot of different things that they may need to be seen for that doesn't necessarily require them to come out of the home if they are familiar with telemedicine.
Absolutely. Well, first of all, telemedicine, like I said, has been around for a couple of decades, but it was used mostly from hospitals who needed to reach out, like rural and small town hospitals that needed to reach out to specialists that they didn't have, like a pediatric endocrinologist, for instance. And they were able to call up that specialist and get advice. So it was like inter-clinic, inter-hospital type communication. It really wasn't a part of the day-to-day activities of a medical practice. However, over the last 5 or 6 years, that has changed a lot. And my primary practice, where MyMD to me was offshoot from, is called Your Place Medical. We are a primary care office. We take care of everybody, like I said, from the womb to the tomb. But I had an extension of my practice where people who couldn't come in or didn't have time to come in would have an opportunity to simply go to our website, hit a link, and there I am, and we can have a face-to-face encounter. And believe it or not, about 85% of what we do as doctors, we can do on the phone, and we can even more percentage if we can actually see what's going on. So very rarely do we have to actually hands-on to determine what your problem is.
Awesome. So where they can go to check to see, if they're experiencing something, to get connected with telemedicine is
Mhm.
your website.
Absolutely.
That website is actually right behind me on the screen. So if you're
Yep.
watching right now, it's Talk About It Tuesday, talking to Dr. LeGrande. Hey, check out her website, mymd2me.com. That is mymd2me.com. I'll go ahead and actually add it on the bottom of the screen as well. So if you're watching, it's Talk About It Tuesday, and we're talking telemedicine. Um,
Yes.
Doc, let me ask you a question. What kind of people do you typically, if we are looking at your website now, and I love this because the very first thing is there is to schedule now.
Mhm.
High quality medical care for everyone. What would you say? You're doing telemedicine now. You've been working all day, and I know we had to push back a little bit because you were seeing some patients. But what are some of the things that you've seen patients for today?
People have a lot of questions about coronavirus right now. Everybody who coughs or sneezes concerned that they have coronavirus. So oftentimes, patients and people want to know, what does this mean? I've been coughing for a few days. Should I be concerned? Or I have a little shortness of breath. Now, unfortunately, we're dealing also with allergy season. So we have a lot of coughing and sneezing and snuffy nose happening that has nothing to do with coronavirus.
Okay.
So we have to spend some time really kind of counseling people, helping them understand that they won't even qualify to be tested right now with some of the symptoms that many people have. But what we want to be able to do is provide whatever you ordinarily would go to your primary care doctor for during this time where we're staying at home. You can call us. We're not trying to take you away from your primary care. If you have a primary care physician, please keep that person, and we can also send information, your records, to your primary care physician if you choose us to. But if you don't want to go and sit in the middle of some sick people because you need your birth control pills refilled, you might just want to give us a call. If you have high blood pressure medication that you get every 3 months, but you really can't go to your cardiologist or your doctor and they don't have telemedicine, we can definitely help you there. You can take your own blood pressure and pulse with a machine that I bet you have at home. Tell us what the results are, and from there we can tell you about your medication. We'll refill it. We'll let your doctor know what we've done. And hopefully next month, this time, you can be back with them, or you can just call your place medical, and that's okay too.
I love that. So basically, how it works is they get online, which the website is scrolling at the bottom of the screen right now, mymd2me.com. They can schedule an appointment, and they will be able to see you on their phone.
Yep.
Is that how it works? Just like this?
Just like that. You can see me on your phone or your computer or any device that you have.
Okay.
The better the device as far as, video quality, audio quality, the better the device, more up to date the device is, the better your connection, the best Wi-Fi you have, or if you're on a computer, if you have Ethernet, just direct input would be best. So the best, internet that you have, the best devices, then you got the best communication with us. But we work, I see patients all day long. Some of them have really not too great devices, but we work through it. Most people have really good smartphones, and it works just fine.
So after they see you and you diagnose them through their tablet, their device, then you just simply send the prescription to their pharmacy?
Oh, absolutely. It's called e-prescribe. And so all I do is go on part of my electronic medical record program. I can go to a prescription page, put in the medication that they need. Let's just say it's their birth control pills or whatever it is they need, their high blood pressure medicine. I'll put the medicine in, the dosage that they've taken in the past, or if I'm prescribing something, then I'll just put the dose that I think that they should have. And I push a button after they tell me their pharmacy, the pharmacy that they want their medication to go to. We push a button and it goes to that pharmacy. So all they have to do is go directly to their pharmacy and pick up their prescription. So no paper is needed. It's a paperless, completely digital process. Easy to do. Very fast. An office visit is, it depends on how chatty the patient can be. We can be 2 minutes to 20 minutes. There's no time limit. I don't shut people up. I like talking, as you can tell. And, we just have a good time. And when we're done, and it's easy. It's very inexpensive. It's $60, which is less than some people's copays. So,
wow, that is less than some people's copay. You know, what I like is the fact that not only can you send their prescription through electronically, but right now with the stay-at-home orders, there's lots of pharmacies that are delivering prescriptions.
Yes.
So
yeah, that makes me feel better.
Right, can happen virtually. You can stay at home. You can stay safe. You've mentioned birth control a couple of times, so I'm just going to say this. Don't stay at home and get pregnant and then blame it on you couldn't get to the doctor, because we're here with Telemedicine with Dr. LeGrande. Talk about it Tuesday. There are options for some of the simple prescriptions that you need, simple things that you're going through that can keep you at home all through telemedicine.
Exactly.
I like it. I love it. I love it. So I am looking here, and if you're tuning in right now, we're talking to Dr. LeGrande. Talk about it Tuesday. We're talking telemedicine and some of the things that you treat telemedicine for. It says right on your website, we treat for primary healthcare, non-emergency conditions.
Right.
So if you are experiencing upper respiratory infections, sinus headaches, urinary tract infections, any of those simple things, that would be the person, Dr. LeGrande, that reaches out to you?
Absolutely, yeah. I want to make a point is that it says non-emergency.
Yes.
We have 911 for a reason. And so if you're bleeding and can't stop it, that's a 911 call. If you're having chest pain, that's a 911 call. So there are certain things that we are not set up to take care of. And sometimes it requires us talking to you to determine if that's the case. For instance, someone may have abdominal pain. Well, they could have just ate something bad yesterday and having a little griping, or they could have appendicitis. And sometimes it's impossible to tell either without examining. Okay. So there's some situations where I'm going to have to say, I cannot say for sure what's wrong right now. So I need you to go in to an urgent care center or to an emergency room for examination, or come to my office tomorrow and I can examine you. But for right now, I cannot say. So there are some things we are not going to say, this is a situation and here, take some medicine and go away. That is not going to happen all the time. But a consultation makes that determination.
Okay, and then you mentioned that they can come into your office. Can you tell us where your office is located? Because you're an essential business. So if you just want to see Dr. LeGrande face to face, she does have office appointments as well.
Absolutely. We have two offices, and one at 2822 West Virginia Avenue. We are right in front of St. Joseph's Hospital, behind the Checkers, who I guess that they're an essential business too, because the lines are very long there. And so we are at 2822 West Virginia. The phone number there is 813-443-0866. And we're open 9 to 5 like most businesses. I have 2 nurse practitioners that work with me, and they do primary care, as well as the other business that we have is called Compassion Care, and that is for pain management. And that's 2 separate offices, but in one office, 2 separate businesses, but in one office.
Awesome. I see from your website, it says our VIP treatment. So if you all don't know, I love VIP treatment. So that sticks out to me. One thing it's quick online visits. So a lot of times when you go in the doctor's office, you do have to wait a little bit.
Yeah.
And you don't want to do this or have to do this during these times with the stay at home. You never know who's sitting next to you.
That's right.
Quick prescriptions, e-prescribe. I want to make note, for me personally, I had to get some prescriptions for my mom. I love the fact that CVS said, hey, we'll deliver them to you. And a professional staff. Dr. LeGrande, since I've known you and been working with you, I have realized not only how professional you are, but your whole team and everyone around you.
Oh,
So,
thank
so when I bring Talk About It Tuesdays, and I wanted to talk about telemedicine because this is so important, I think who you trust your health with is also important. Um,
oh, thank you.
yes, ma'am. So it's Talk About It Tuesday, and it's so easy to schedule your appointment with Dr. LeGrande. See a doctor from the comfort of your home. Dr. LeGrande, if you could tell anyone anything with the virus, because everybody's probably tuning in right now to say, oh my gosh, what can you tell us? What would be something that you can just, give them a little bit of peace of mind on?
Absolutely. First of all, a lot of times as we look at the numbers, the statistics, how many people have confirmed cases, how many deaths, one of the things that we don't talk a lot about is how many people are recovering. Most people do recover from viruses like this. Like most people recover from influenza. There are some people who succumb to influenza because their immune system is depressed, they're elderly, they have other issues going on. It's the same thing with this particular virus. It is not so widespread that you step out your door and boom, it's gonna hit you in the face and you're gonna die. A lot of people are operating in fear. And fear is false evidence that appears real. It is not something that should rule your life, and it's not something that should stop you from living. So coronavirus is a virus. It's a respiratory virus, which means that its focus of causing a problem is in your lungs, in the respiratory system. It can start in the nose, the throat, and goes down into the lungs. It is something that if you do, there are many people who have the virus that will never be sick. I don't know if you've ever been in a situation where you have young children in your home who perhaps go to daycare. As soon as they start going to daycare, then everybody in the house gets sick, but the child isn't sick. Now you get sick, but the child doesn't have that stomach virus. It has kept you in the bathroom for 3 days. Well, that happens because a lot of times children and others can carry certain types of viruses where it doesn't affect them. Their body is able to handle it, but it affects you because you've not been exposed to it and you don't have antibodies against it. And so now you're sick. Well, the same thing is with coronavirus. A lot of people have been exposed to this virus. Fewer people that have been exposed have gotten sick from it, and even fewer have died from it. However, people are dying. I'm not trying to say that it's not important. People are dying. And if you live in the New York area, the New Jersey area, that's ground zero. It is terrible there. One day, 800 people died in one day. So it's a real problem. Don't get me wrong. But at the same time, it is not something that you have to feel that you gotta, be so afraid that you can't live. What are the symptoms? You've heard the symptoms already. Cough associated with shortness of breath. That is the main hallmark symptom of coronavirus is shortness of breath, hard time getting a deep breath. Fever that comes and goes and hard to get rid of. A combination of cough, fever, and shortness of breath pretty much is going to most likely be coronavirus until proven otherwise.
What's the average temperature? What's a high temperature? What's a normal temperature?
Most people's temperature are 98.6 or less. A lot of times it's like 97.8 and stuff like that. That's still normal. So if you have a temperature, say, of 100.1, that is considered a fever.
Okay.
So 99.8, anything over 98.6 is considered a fever. So most people who have a fever can feel it. You can feel warm. You feel internally, something's going on. And it's best just to take your temperature to see. That literally is one of the ways many hospitals are screening patients. Even before they come into the hospital, they have to get their temperature taken before they walk in the door. I recently had a procedure right at the beginning of the coronavirus issue, and the people who came to see me had to get their temperature taken and go through a certain door. You can go only in one door and out only in one door. So those are the kind of precautions that's being taken, but temperature is key.
Okay. One thing, I have someone that's just asked a question. And I noticed it's on the website. So check out the website. It will answer a lot of the questions. But their question was, do they have to sign up long term? Do they have to have an account to be able to jump on to telemedicine and see you?
Absolutely not, and that is one of the differences. It's concierge service without the monthly payment. So a very small fee of $60 gets all of my attention, or my nurse practitioners. There's three of us, and I have another physician for our Spanish-speaking patients. We have a Spanish physician. So we and I did that on purpose because I've had so many Spanish patients that I've had trouble trying to translate and have someone else translate, and I decided I needed to have a provider where translation wasn't necessary because you can miss things in translation.
Yeah.
So to answer that question, no monthly fee. You don't have to belong. You can simply just go on the website. When you make your appointment, you'll be given a link, and that link at your appointment time, you just click on it, and I'll meet you online. It's very simple.
Very simple. So you can go to My MD to Me. Again, it's Talk About It Tuesdays. We're talking to Dr. LeGrande. The website is running across the bottom of this video. Tag a friend, share this video. You know someone that is dealing with some things that maybe have not been able to get their prescriptions refilled, maybe think they have a common cold, or just need to talk to a doctor for some peace of mind. You can go on to My MD to Me. You can see a provider now. You can pick a convenient time to do that. Video chat, phone, tablet, computer. You need a good device. You need some internet. Yeah. You need the doctor to be able to see you and for you to be able to see her, for both of you to see each other.
That's a funny story that you say that. I have some elderly patients who are kind of not exactly tech savvy, but not only that, having a hard time really navigating and trying to in their older phones, right? Mm-hmm. So I had one patient today. She said, "Well, baby, can I use somebody else's phone?" I said, "Yeah." So she went and got her grandchild's phone, and all we did was send the link to that phone, and voila, it was like night and day. So
okay. So it's able to do that. You still got that old flip phone, and it's okay because it does what it needs to do.
Yeah, until it's time to do telemedicine.
Yeah, so it's time to telemedicine. Grab a friend, grab your grandchild, because most of it is going to fall in that category. Grab your daughter's phone, your son's phone, somebody's phone, laptop, because you will need that to be able to do telemedicine.
Absolutely.
That is awesome. If you are just tuning in, you've missed a lot of great information. It is Talk About It Tuesday with Dr. LeGrande. You may recognize her from the cover of the previous edition of IBA Success Magazine. Her full story is there. Now with the stay-at-home order, she has opened her practice to primary, to telemedicine, to helping you all stay at home and get some of the basic needs met by seeing a doctor, alongside with getting your prescriptions emailed electronically. We're cutting down the use of paper, and we're making sure that you're still able to be serviced. My MD to Me, I think it's awesome. You know, I have never experienced telemedicine, but one thing for sure, if I need anything at this point, I'll be using telemedicine.
Awesome. Look forward to that.
Yes. So is there any last words, Dr. LeGrande, that you want to answer? Like, what would you say if you haven't already covered it? Some of your most common questions are about telemedicine.
Well, the most common question is, how does it work? And, you know, it's as simple as clicking a link. That's the bottom line. And then everything is told to you on the screen. So it's very, very simple. You don't have to download any apps. You don't have to do anything except click the link. It's simple as that. When you click the link, your phone is going to tell you to give permission for your camera and your microphone. You allow that, and then then we're on with you. So it's very simple. It's easy to do. It's inexpensive. I'm very dedicated to taking care of my patients, whether I'm talking to them on the phone or whether we're sitting in front of each other. I'm excited about telemedicine and where it can lead. As I was telling you, Jennifer, my desire is to be the doctor for Florida visitors, people who are traveling who are coming here and don't know where to go, and their primary care doctors back in Arkansas or Australia. I want them to know they can call MyMD to me in case they need help, stayed in the sun too long, or a kid got an ear infection or whatever. So I'm excited about where telemedicine is going to take us. I'm excited, coronavirus is not something that I am glad happened by no stretch of the imagination. But anytime there's something negative that happens, you'd be surprised how much good can come out of it. And so one of the good things that's come out of this is that telemedicine has come to the forefront. I've been trying for 2 years to get people to see telemedicine as a useful tool. And now you can see it as a useful tool. So, even in the midst of bad things, that's why the Word of God says all things work together for good for those who love God and those who are called according to purpose. And guess what? I'm called.
Yes. Amen. Dr. LeGrande. We have a question regarding confidentiality, HIPAA.
Yes.
How secure is the question? How secure is this device where someone else can't see what's going on?
One of my biggest fights that I've had in getting a good telemedicine platform was that very question, because most of the platforms are so extremely expensive that are HIPAA compliant. Okay. Thank God, I found through my wonderful little tech person. His name is Nasser. He's a sweet IT young man. He searched and searched, and he found a platform called Doxy.me. It is HIPAA compliant. We've researched it. Many medical facilities, huge medical facilities across this country use Doxy.me for telemedicine. And so that's how it's not necessarily in my control. It's in the control of the platform. And the platform has all the documentations for HIPAA compliancy. And so therefore, the guarantee is with them, Doxy.me. So you can look them up and you can see their HIPAA compliancy.
Awesome. Another question that just came in is forms of payment and how is the payment processing done?
Just like everything else, it's digital, baby. So it's digital. Pull out that card and stick that number in. And just like you buy anything else online, it's the same exact thing. If you're buying grocery or if you're buying healthcare, it's the same thing. You just use whatever card you have, all of the major credit cards, your bank cards, whatever. That's how it's done digitally.
And it's only $60. Is that the standard rate, or do we have any? Is that the promotion that's going on?
That is the promotion. That's the stay-at-home rate.
Okay.
Because the service usually starts at $99 if we're just maybe calling a prescription, to $149, and that's for a full evaluation. So this $60 is a stay-at-home rate because I expected that people needed the service, and many people don't necessarily have $100 sitting around, especially if they're not working. So it's just a lot easier for them, and that allows us still to be able to do, because I still have to pay my nurse practitioners, and there is an overhead. So, but it is something that we've made affordable, but it is a special rate during this time.
Awesome. You are watching Talk About It Tuesday with Jennifer Yon Agency. As always, I'm excited to bring you great individuals that can educate and empower you. Health is so important. I'm so happy, Dr. LeGrande, that you are here today talking about telemedicine, talking about how we can keep everyone home to still be serviced. Yes. And give them peace of mind. Yes. You're watching, tag a friend, share this video, and visit Dr. LeGrande at www.mymd.com. MyMD to me.
The number 2 me.
Yes, the number 2 me. It's running across the screen. MyMD, the number 2 me. Simple website, easy to understand. You can do this. You can still be seen from home right now. Are there hours? What are the hours?
Oh, well, the hours is just regular business hours, 9 to 5. For right now. At some point later, we'll actually be 24/7. But right now we're 9 to 5. That's how we can keep the prices low. That $149 price is a 24-hour, 7-day-a-week price. So that's one of the reasons why it's there. And so with $60, we can just do 9 to 5.
Awesome. Make sure you check her out. Again, thank you, Dr. LeGrande, for joining us to talk about it.
Thank you.
You're welcome. If you are watching like Jennifer Yon Agency, look at some of our videos. Also, you can subscribe to my YouTube channel at IBA Success. Go to YouTube, Google me, share this video because everyone's watching. I know you know someone that needs to get their prescriptions refilled. Okay. All right. Have a great night. Again, thanks, Dr. LeGrande.
Thank
And
you.
we'll see you all later.
Absolutely. Thank you, Jennifer.
You're welcome.